happened, but that's just kind of as far back as this chart goes. And you can see we had that first bump in the springtime. And unfortunately, what you can see now is that we are slowly coming out of our second spike. And that kind of coincided with the holidays and what I'm sure are just a lot of infections related to holiday gatherings. But that is slowly and quickly coming down, which is great news. Also note that around late December is when we started giving, like just after Christmas, I believe, or is when we started giving COVID vaccines to phase 1 eligible participants. So that is healthcare workers, residents of nursing homes and long-term care facilities. And then in the month of January, that kind of, continued on to include other members of phase 1B and C, and that includes first responders like EMS, police and fire. And then towards the end, we started vaccinating other healthcare workers like home health aides, dentists, physical therapists, and the like. So I'm hoping that is part of the downtrend that we're seeing. But I just looked at the data, and to date, the state of Massachusetts has only fully vaccinated about 1.3% of its population. Going into vaccines, lots of updates on vaccines. Kind of to take a step back, we have 2 of them available in the United States that have been authorized by the Food and Drug Administration. They've been authorized for emergency use, and we have certainly been using it for that reason. 2 is Pfizer, that's one of them, and then Moderna is the second one. As a Revere, as a board of health, as a local board of health, the city of Revere has been administering Moderna vaccines, mainly because of storage issues. The biggest difference between Pfizer and Moderna is that Pfizer needs to be stored in very, very cold temperatures, and we just don't have the special fridges needed to accommodate those super low temperatures. But Moderna can just be placed in regular fridges that other common vaccines are already placed in. So that's kind of where that comes from. Otherwise, both vaccines have the same efficacy after you get both shots. You need 2. They provide about 95% efficacy at preventing severe coronavirus infections. They both code for the same spike protein on top of the coronavirus, and they're both composed of mRNA, which is the kind of vehicle that the vaccine is using to get this information to our body so our bodies can make antibodies to fight off COVID. So we've already begun vaccinating, first responders, and hopefully we'll start to vaccinate other eligible individuals in phase 2. Speaking of phases, this is kind of what I was alluding to in the beginning when the vaccines were approved for use. We started in phase 1, obviously, with healthcare workers who were in direct care of folks who have or could have the coronavirus infection, and then there were other folks who were encompassed into phase 1, and that's first responders, congregate care settings, home-based healthcare workers, and the like. You'll see at the bottom, there is a rough timeline too. So December to February is kind of when we did phase 1. We're now in February, and a lot of hospitals across Massachusetts have begun to vaccinate patients, particularly those above the age of 75. As you can see in the middle there, individuals above the age of 75 are the first wave of phase 2. There are a lot of other mass vaccination sites out there. You can check them out at mass or MA immunizations with an S.org. And that's how you can determine if you are eligible, and you can determine kind of where you can get those vaccines. I'll tell you 2 of the major mass vaccination sites are Gillette Stadium and Fenway Park. One of my patients actually went to Fenway Park this morning to get her first Pfizer vaccine. So that was exciting. And hopefully as a local board of health, we'll also be able to offer our residents above the age of 75 this vaccine as well, once we kind of hear about that, which I'll let Lauren get to, I think, if she has any updates. Just one final thing, I'm going to stop sharing my screen. One final thing I want to mention, I want to put a plug in for all residents, if you're out there listening to this, to just call 311 or go to the revere.org website and make sure your contact information is up to date with the city so that we can give you the most up-to-date information on whether or not we have vaccines to give to our residents, because we'd love to give it to you as fast as possible. Having said that, in order for us to kind of be out of the woods, we have to have enough like a high enough percentage of the population vaccinated in order to achieve herd immunity. And the magic number for that is usually around 70%. So we're at 1.3% as a state. So we have a ways to go. So even if you are out there and if you have received the vaccine or you're about to get it, just please continue to do what you have been doing for the last year. Wear a mask, social distance, wash your hands, and just be vigilant about your symptoms. Those are the main updates, kind of 1,000-foot updates on COVID that I have. And I don't know if, Lauren, do you have anything to share about vaccines and any updates about that? I know you've been working hard. Sure.
So I can give two updates. The first update is about kind of our outreach campaign that we started. We started on Sunday, kind of ramped up on Monday and Tuesday. So we're 2 days into our outreach campaign. The campaign is called Reach Every Senior, which basically is people, volunteers, residents of Revere who have had some training in kind of the options that are available to our residents who are 75 and over, which is, again, the current phase that we're in terms of vaccination. So they've had some education about the resources that we know that are out there, and they're hoping to reach as many seniors as we can to help everyone feel comfortable with the options that are available to them. We know this is a really hard process. We know that it takes some computer literacy skills, which is unfortunate that we've had to kind of resort to kind of an online registration process. And so part of this outreach campaign is to help people feel more comfortable with the process and kind of make sure that we're getting in touch with the people who don't have the capacity, who don't have the computer literacy capacity to make sure that the registrations happen. We to this date, as we speak right now, I think we've reached about maybe 400, 450 seniors. Obviously, we have a long way to go. And that's why the campaign is going to continue until we try to hit every senior that needs our help. The great news is a lot of the seniors that we're calling, they have registered for COVID vaccine appointments already. And again, this is a lot of the education we're doing. A lot of people have heard from their healthcare providers, not necessarily their primary care providers, but the health systems that their primary care providers are associated with to register through those clinics. And that's a great option. We're definitely that's a great option to have. So a lot of people have already found their way. If you haven't, it's okay. We're going to help you through it. Expect to hear from us soon. We'll try to get through as many people as we can, as quickly as we can. And we have a lot of volunteers to help us with that. So we have started that process. In terms of us as a Board of Health, with our current vaccination stock and what we're looking for in the future in terms of providing clinics to our residents directly. So again, those of you who are listening in who've heard me talk about kind of our clinics before, I apologize, this is repetitive. We did our first doses of our first responders about 2 weeks ago now. We did our first dose of everyone in phase 1 who was also eligible last week. So this week we are moving on to our 75 and over residents with a vaccine clinic of our own. That being said, we are in no ways capable of being the sole vaccine provider for our city because of the stock supply that is not coming from just the state, but coming from even the federal government. We are actually only able at this time, and this could change very quickly, to only order 400 doses of a vaccine at a time every week, which means that our capabilities of vaccinating every resident who's eligible, it won't be it's not necessarily a quick process. We're one of the options available for you to get your vaccine. We want to make sure that our clinics are targeting those who don't have any other options. And that's kind of what we're doing with a lot of the training that has happened over the last couple of days and trying to get people appropriately registered for our clinic. So, we do have a commitment to the city that as a Board of Health, we will continue to vaccinate in our capacity. We won't stop doing that. As these next weeks come up, we will be starting with our second doses. And this is another kind of logistical component that these vaccines are kind of thrown at us that many other vaccines don't have, which we have to get everyone back in 28 days. So next week, we start our second doses. This will be our first second dose kind of clinic that we have for our first responders. So that's another logistical component to this, where it's not necessarily as straightforward as we'd like it to be. It's not necessarily as easy as we'd like it to be. So it's a lot of work on the front end to try to get everyone through in the right and safe way. And so we'll starting that next week. Doesn't mean that we won't be giving first doses next week either. It just means there's a lot of considerations we have to make that happen. But we're committed to doing as much as we can as a Board of Health. And, for people that we can't reach ourselves, that's why we have the campaign to make sure we reach everyone, at least give them the information that they need to know about the other options that are out there. So that's kind of where we are as a Board of Health. And yeah, the process is very fluid. Things change very quickly. We learn at every clinic we do. We change our methods every clinic we do to kind of make sure that we're fixing the things that didn't work and keeping the things that did work. So everything could look a little different in a couple of days. That's just how this whole pandemic has been. But we're moving right along with the phases ourselves. So that's my update of where we are in the process.
Lauren, I'm glad you're at this meeting today. I actually had a question about the vaccine clinic too. I had one of my friends, he does a lot of equity research. He actually asked me if any of the mass vaccination sites are collecting race or ethnicity data. And I obviously can't speak for a lot of them, but I looked into our own and I looked into PrepMod, and it looks like we're actually not doing that. And I'm just wondering if that's something we should be incorporating into the registration for PrepMod.
Yeah. So there is a race and ethnicity question when you sign up. The thing that potentially skews some data is there is an option to say, I don't want to, I choose not to answer or unknown. But there is the option when we're registering people to fill out that information. So yeah, as much as people volunteer, we are collecting.
Gotcha. Okay, so I was probably just looking at PrepMod wrong. I was just, I probably just didn't know how to search for it. I kind of just played around real quick. Yeah, because that's something that comes up a lot at MGH is, equitable access. I mean, obviously we're limited in what we can get, both as a city, but also I think just the supply chain is being a little bit short. So MGH has begun vaccines, and they are specifically reaching out to the communities that have been hit hardest, which Revere is among them. So I was actually calling a lot of my patients today to help them book their appointments at MGH, because we're able to do that now. So hopefully we'll get everyone in as fast as we can, as safely as we can. But yeah, just thinking about equity and thinking about making sure everyone gets it, especially the folks who've been hit hardest, which happen to be minority patients. So it's something to think about. I don't know, was that it for the agenda, Mike and Marcia?
Yes, there was only COVID-related business tonight. Okay.
I don't know if we want to kind of, does anyone else have Neza or Mike or Paula or anything else to add? I just want to be mindful of everyone's time. I know Lauren's been busy working on all the clinics, so I mean, it's good that we're kind of
Paula too. She's my right hand. We've been tackling together.
Right, exactly. And I know everyone's kind of out straight right now, so I want to be mindful of everyone's time. Thanks, Marcia, for getting us all the agendas and keeping me on task. I'm bad at that, but we can adjourn the meeting if you want, Mike.
Yes, motion to adjourn.
Awesome. Thanks, everyone.
Have a good night, everybody.
Thank you,
everyone.